For more analysis into this case, we're now joined once again in the studio by our current affairs commentator, Mr. Victor Gao Zhikai. Well, first of all, tell us, well, since this is the first anti-monopoly case in China in the pharmaceutical sector, what exactly does this case tell us about the national pricing system?
First of all, the drug prices in China are highly regulated by the Pricing Bureau. And however, in more recent years, the pricing of drugs in China has become plagued with many big scandals. As a matter of fact, for example, the former head of the China Food and Drug Administration, Mr. Zheng, was actually executed for violating rules and laws in terms of issuing licenses for producing drugs. And more recently, for example, high-ranking officials in NDRC's Pricing Bureau have also been investigated for violations and crimes. And as a result, I would say the pricing of drugs is a very sensitive issue, and sometimes it can be very controversial. In this particular case, I think the government authorities did the right thing because it went into the details of the violations by these 5 domestic companies producing drugs. And what they tend to do is to control the pricing of the drugs they produce by forming kind of a monopolistic operations in these drugs. And I think what at stake is the fundamental legitimate interests and the rights of the consumers, who are mostly the patients who need to use the drugs. And they have no other option. They have to be forced to pay exorbitantly high prices for the drugs. And also related to this problem, some of the hospitals or the doctors administering the drugs have also been involved in these scandals by prescribing more drugs than what the patients will need, or highly price the drugs than what the patients will need. So I would say that this probably will not be an isolated incident. This probably just exposed the tip of the iceberg in the pricing of the drugs in China, involving not only domestic drug companies, but also foreign, international, big houses producing drugs. We know there was a major multinational drug company which had been penalized for similar offenses, and this time the focus is on domestic companies in important cities like Shanghai and Chongqing. Hopefully the government authorities, the law enforcement authorities will go to the hilt in exposing and disciplining and punishing these violations, so that eventually there will be greater transparency and equity in the pricing of the drugs. So eventually the patients and the consumers in China will get a fair dealing and fair play when they need to pay for the drugs.
But with that being said, actually, we all know that medicine is actually a matter of life and death to people. But to chase higher profit, many pharmaceutical producers stop to produce any low profit or low price medicines, even including some cancer drugs, cancer medicines. Can we expect, with this case emerging, can we expect a new round of discussions on the matter of opening up the pricing system?
Definitely. In China, the drug sector has major problems, partially because, in many hospitals, which are government-controlled and government-owned, they actually only charge a very, very minimum amount for prescribing and treating the patients by the doctors. As a result, many hospitals have to make more money out of the drug sale to the patients, to make more money out of that in order to balance off against the low income they get from prescribing for the drugs. And partially related to this, there have been major scandals involving the production of the drugs, the licensing of the drugs, the pricing of the drugs, and also the overpricing of the drugs when the hospitals administer the drugs to the patients. So I think the issue is not isolated. There is a whole range of issues. Comparing China's drug industry with that of India, for example, despite the fact that there are problems in the Indian drug industry, at least the patients in India get low priced drugs for the masses of the people, whereas in China, the highly priced drugs actually do not work out as a good service for the patients who mostly cannot afford such highly priced drugs. As a result, they got shortchanged when they need to get the drugs for the curement of their problems. And I think this is one particular reason why eventually there need to be fundamental reform and restructuring of the drug industry, including the pricing of the drugs in China.
Right, well, of course, there's still a long way to go to regulate China's pharmaceutical industry, but we're on the way, at least.
Thank you.
Thank you very much, Mr. Victor Gao Zhikai, our current affairs commentator.